Everybody, welcome back to the channel. It's Dr. Perlman. I hope I'm able to get through this in one take. So I made a video. I'm not the guy who goes to the gym and takes the videos, but I felt like, again, sharing my journey post back surgery was very important because, especially, right after surgery, I'm sitting around so much that regardless of any progress I think I'm making by moving, there were so many setbacks. And so I was like sharing my journey, you could say. And so what I did was I decided, today, because I've now been to the gym like just about every day over like a 2 to 3 week period, I've really been getting much noticeably stronger now in my eyes. And even though I'm still in pain, it's more like normal pain. So here we are, 1 year and 3 months to be specific, which I love being specific. But let's just say, about a year, post surgery, like where am I at? What does that mean for somebody else who might be in the same condition? I think often you hear a lot of horror stories, especially now with this stuff going on with the New York killer of the CEO. It's like failed back surgery, pedicle screws placed in wrong, ruin people's lives. And, oftentimes, you'll hear chiropractors being like very negative when it comes to, kind of traditional medical approaches that lead to surgery. Whereas I definitely am a conservative minded chiropractor in the sense that surgery should be the last resort. But through my own personal experience and experience as a chiropractic provider, I can say if I feel somebody needs to consult a surgeon and that they are indeed a candidate for surgery, they are going and they're going fast. I don't like doing, as one of my good friends puts it, delaying the inevitable. There's no need for that, especially when you're 30, 40, 50 years old. That's the age range demographic of a lot of people who will begin to have very severe back pain. And once you get into that realm, even if it's not the most devastating injury associated with the back pain, but usually there is a mechanism of injury. Usually this is fairly certain that there was like a one, you fell on your butt, you hit the crown of your head, there's some kind of a compressive fracture, and then the bones try to fuse themselves, and through that sustained injury and the fusion of bones that turned into what we call arthritis and what we call calcifications, and that leads to the narrowing because the bone thickens to try to keep the joint stable. You become, or you'll have a level of stenosis that then requires surgery. That stenosis could be compressing actual nerve roots, it could be compressing actual cord material. And so what I've noticed was the biggest hurdle in healing for me from laminotomy, foraminotomy, a lot of people just flat out have a full laminectomy, is what we call fair learned behavior. In other words, my biggest hurdle is every time I feel discomfort or pain in my lower back, my brain automatically switches, boom, like full-blown protection mode. There's going to be spasms. And since surgery, I've had like pain or that unstable feeling a few times, certainly some achiness and a lot of soreness, but it hasn't gone out. And in theory, if the surgeon did their job to the best of their ability, the back really kind of can't go out because the nerve roots won't get compressed and the cord and material and ligaments around the spinal column at the bottom, those discs, those disc bulge and disc herniation areas, won't be able to get so compressed that my back locks down and puts me walking crooked. So the learning curve of like feeling a little tender and tight or vulnerable in that area and not having the back go out has been the greatest challenge. And I'm curious, for those of you out there who've had laminotomy, foraminotomy, laminectomy, foraminectomy, usually you would only say foraminotomy, I believe, or laminectomy, and then laminotomy is partial, where they go in and like, let's just say this is the hole, like where the spinal nerve root comes out, right? They take a similar instrument, go in through the hole, they clean it, and get it cleaned out. So that's what I had. I had it L4, L5, L5 S1, both surrounding joints. So if you looked at like my nerves coming out of my spine, if my head and nose was like my spine and the nerves are coming out this way, they cleaned like all of this out at the bottom. It was definitely not a pretty picture down in my rear end after surgery, but it's invasive. And I literally was coming back to the office 2 weeks post surgery to adjust patients because, I didn't want to close my practice. That's also why I didn't opt for the fusion, which would have just taken any type of possible slip of that bone, L5 on S1 or L4 on L5 or both, or continued issues with the disc. I opted not to have screws put in because I didn't want them put in on like a quote unquote bad angle. The margin for error is small. I mean, in the words of Al Pacino in Any Given Sunday, right? Um, you know, a few steps too early or too late, a few inches too short or too far, is the difference between winning and losing, right? Living and dying. And in that regard, yes, your life is at stake when you're on the table, but 99% of the time you're going to wake up from anesthesia. But the margin for error is so small. And if you even think about it, take it down to like chiropractic and what I do. People aren't getting put to sleep, but if I'm adjusting somebody's back and they have a tender disc or their area is really flared up and they're locked up and having a tough time, if I'm 2 centimeters too high or 2 centimeters too low, and that disc material moves 2 millimeters too high or 2 millimeters too low, or 2 millimeters to the left or to the right, and I'm not specific, and I thrust and it doesn't release, they will get hurt. And what's the hurt from a chiropractor? Well, it's sprain, strain, right? Sprain ligament, strain tendon, strain muscle, spasms. Totally, it's happened before. It's happened to my patients. Happens maybe 1 out of every 500 adjustments given. Maybe it could be more like 1 out of every 5,000. But the point I'm making is it's very rare, but it happens. Some of you patients out there might even know, like you're like, he pushed on me, oh my back. I mean, it again, so rare. But think of a skilled surgeon, right? They go in there and their margin for error when they make a mistake is they cut off the wrong nerve. They snip something that starts bleeding profusely, and they need to call in a different surgeon to help clean up the vasculature. They don't clean something out enough, or they got on a wrong angle and you still have pain going down the leg. I've had crazy stories of people that have gotten up from surgery and literally had pain like radiating down their leg because those screws put in too tight on a neck fusion. Like, I've seen people who've had full-blown scoliosis, spinal fusion, where they're fused from like C5 to like L5. Just full spine scoliosis used to be like this, and now it's straight. And the their screws are put in a little too much like this, and their neck is turned like that. You see it on an X-ray, and their presentation is, statically, when they're sitting in the chair, and you watch their body try to still compensate, even with those rods in. When the words of John Hammond, right? Life finds a way. The body's brilliant. So, how do we get here? What have I done different? I think a lot of it is just that the body is resilient and it takes time to heal. And healing taking time, as I've said in the past, does not mean a few weeks. It means sometimes it takes months, sometimes it takes years. I'm 42 years old. I'm not going to get younger, and every time that the tissue gets irritated, tendons, ligaments, cartilage, disc, bone, bruising, it takes longer to heal. The body needs to be given those instruments of health: chiropractic, nutrition, supplementation, rest, recovery, ice, heat, whatever. And of course, Shockwave has been instrumental for me, not just in my practice for my patients, but the reason I brought it into my practice is because how it's helped me so much aid in the scar tissue and chronic pain sites and really calming them down. And now that's allowed me to do some of the exercises that I put on the video this morning on the reel on Instagram, and then I made a little short on YouTube, kind of sharing the journey that's led me to now. So I hope that this video provides information. I mean, I'm at about 10 minutes now, and I realize, I've just talked about, the mechanisms that led to the idea to needing surgery. I've talked about what it was like, post-surgery, coming back a little too fast, needing to have time to recover. But what it really looks like in terms of the care, chiropractic, shockwave, exercises, what I was doing this morning, modified deadlift and that like hex bar squat deadlift, lifting from blocks instead of all the way from the ground, using kettlebells properly, doing glute abductions, building up the glutes after they atrophy for a lot of people that have had spinal surgery. Because the nerve roots and the blood supply is just going to be, not going to the muscles that it, used to go to, and you need to find ways to stimulate that activity and get it going again. There's so much more I could talk about, but I'm going to leave that for another video. And everybody, thank you for tuning in. It's Dr. Perlman.